I'm Larry Menti. Welcome to Another Thing. Obesity in America is a major health problem, and it's just getting worse. That has prompted state and local governments to propose a tax on sugary drinks. Now, those who endorse that so-called soda tax say that it will help to fight obesity. Those opposed say this altruistic aim is just a facade for the real goal to raise taxes. So far, only one municipality has been successful in passing such a tax, Berkeley, California. But that doesn't stop cities like Philadelphia from trying and trying again. We begin our coverage with Kolodziej from the city of brotherly love and the proposed soda tax. Ellen.
Thank you, Larry. Now, most people believe this soda tax affects just that, soda, but it actually affects more than 1,000 sugary drinks, including coffee and even juice boxes. And even one presidential candidate believes this tax will hit poor people the hardest.
Many products could double in price. Take action. Contact your city council member today because 3 cents adds up fast.
Philadelphia Mayor Jim Kenney's plan to slap a 3-cent tax on soda and other drinks to pay for pre-K would be the highest in the world, so it's getting national media attention.
You can choose to drink something else. We're not taxing thirst.
But his plan to raise $400 million over 5 years seems to be fizzling with some critics, even presidential candidate Bernie Sanders.
You get a 12-ounce bottle of soda, that's like 30 or 40 cent tax on that bottle of soda. That's 5 bottles, a bottle a day, that's, $2 a week for a low-income family. That's a lot of money.
It's a regressive tax, and because it comes from a public relations consultant or comes from a corporation, sometimes people don't believe it. When Bernie Sanders says it, it's validation.
Larry Seisler works with the group No Philly Grocery Tax. They're trying to spread the word about just how much this tax would cost people. Berkeley, California is the only other city in the country with this kind of soda tax, and they have a penny per ounce. Philadelphia's would be 3 times that.
It's about a revenue grab by the mayor. I think that the mayor probably, when this process started, had the votes for the tax, but I think as time has passed and we've had a chance to educate the public and council, he probably doesn't have those votes today.
We reached out to the mayor's office several times for a comment, but never got a response. Now, one city councilwoman has come up with what she considers a compromise. It's called the container tax, and it would add 15 cents on to all containers, even water. And we shall see how it all plays out. Reporting for Another Thing, I'm Kolodziej.
All right, thank you, Ellen. To talk more now about the soda tax proposed in Philadelphia and in other places, Lou Cooperhouse, who is the director of the Rutgers Food Innovation Center. Before we get started, thank you for being here, by the way. What is the Food Innovation Center?
Well, thanks so much for having me. The Food Innovation Center is actually an economic development program of the Rutgers, New Jersey Agricultural Experiment Station. We're physically based down in Bridgeton, New Jersey. We support food entrepreneurs and also established companies, both domestically and globally, in helping their businesses get launched here in the U.S.
Do you have any standing in this soda tax, either through the center or personally?
Our interest in this whole soda tax is really more from the perspective of so many of our clients are focused on healthy, nutritional foods. So we've seen just a huge interest in that. We are not on the public policy side. So our interest is really more on the economic development side of what we're seeing in industry. So my perspective is really more personal, but also based on where we're seeing the whole industry change as it relates to our entrepreneurs that we're seeing.
Now, since you say the entrepreneurs and the companies you work with are caring much more about health, and that's good marketing too, because it seems like that's what's selling these days. Is the obesity problem taking care of itself? In that, is obesity going down in this country?
It's not. Actually, from a background, I've actually worked at Campbell's, Nestle, and Conagra, and I've been involved with a nutritional food startup, so my interest in this whole category is long-standing. Sadly, between obesity and overweight, the CDC estimates roughly 2/3, a little more than 2/3 of our U.S. population is overweight or obese. It's absolutely a national problem. The conditions are obviously affecting our healthcare costs, just affecting us in the billions and billions of dollars nationally. Is something we need to deal with. However, we're also seeing obesity not changing in recent years, but interestingly, sales of sugar-containing beverages have declined.
Because significantly,
actually. I believe the numbers is roughly 25% in the last 10, 15 years. Not just sugary drinks, but also diet beverages, as consumers are just really looking and embracing health and nutrition in new ways. There's so much more we can do to embrace nutrition and health, but the question is imposing a tax on sugary beverages the right approach?
Well, you asked the question. What's the answer?
Personally, I think it's not the right approach. I think there's so much more we can do in education and really looking at how we can, rather than penalize people for ingesting these kind of sugary beverages, in fact, promoting healthy eating through fruits and vegetables, introducing them earlier in primary schools, and really introducing healthy food selections at an earlier age. And also, sugary foods, like all foods, it's all about moderation. So whether we like or dislike the sugary beverages that are in the marketplace today, we're seeing consumers that are actually getting understanding more about portion control. Maybe they might cheat, if you will, and have a sugary beverage, but they might eat healthier later on. So
let's stay with the sugary beverage for a second, because if the statistics you said are correct, and I'm sure they are, that obesity is continuing to rise and/or staying steady, and the consumption of sugary drinks and sodas is down 25%, then you would think that's not the culprit.
That's what you would think, yes. It sounds like that'd be a correct assumption, but there are so many factors that cause.
And yet it's vilified as the #1 culprit, and the statistics wouldn't bear that out.
Because it's a complicating factor. Disease and diabetes and obesity have so many factors that cause them. Clearly, reduction of sugary drinks has a benefit, no question about that. But that is just one of so many things that are really the cause of obesity and diabetes.
The one benefit seems to be overwhelmingly, and this has been studied, is that local governments do make more money. They end up making more money, and I guess the tax now in Philadelphia would be 3 cents for every ounce that they would charge, which would have a dramatic impact on their local budget. Because has there been any statistics to show at least that people have cut down on the consumption based on the tax, or they're just cutting down anyway?
They're cutting down anyway. And I think I personally have an opinion too that obviously people that are the least likely to afford foods in general might be disproportionately affected and might end up paying more for these products. I just don't know if this is really a proven methodology to create change. It's all about changing consumer behavior. Is the way to change consumer behavior by taxing them, or by educating them, through your peers, through your parents, in schools? To me, that's just a much more positive way to make an impact change.
So it seems to me that even though the Innovation Center isn't taking a position on this, your position is it's not a good idea.
That's correct. It's not a good idea from my personal opinion, but our center, in the meantime, seen just a huge growth in healthy foods. It's an absolute national trend. The whole consumer landscape has changed. The way foods are being sold. Consumers are looking for healthier, prepared foods with cleaner labels. They're absolutely reading labels much more than we've ever seen before. So what the good news is that we are making a change as a nation, but not necessarily through a tax.
And it has nothing to do with the tax.
That's correct.
Thank you, sir. I appreciate you being here. Lou Cooperhouse, Director of Rutgers Food Innovation Center. When we come back, as you know, there are stars taking part in a boycott of North Carolina because of their bathroom policies when it comes to the transgender individuals. We want to talk about the effectiveness of those boycotts when we come right back.